Magdalena asks, are there any suggested levels of hormones for your age? What do you mean your age? In the lab, you get suggested level, but for your chronological age, oh, how high can the level be compared to younger women if you are in menopause? I did you understand the question or
Yeah, I do.
yeah, okay.
Yeah, so I would answer that with that is all over the board because I have women who, you want to be kind of in a nice little balance, right? But when you kind of look at sort of the scale of norms, um, I have women who are doing really, really, really well with relatively kind of in the low end of normal, and women who like literally just nothing's changing. They're still fat. They're still can't do anything. They still, and I have to push those hormones up. So can you be too high? Yes. You can, but typically that's because of how things are being metabolized, right? So if metabolism is good, so you can overdo it with hormones because too much of a thing is never good, right? But can you be on the high end? Can you? Yeah, I think that if you look at where our hormones were ideal, quite frankly, for women, very young. I mean, 16, 17, 18. That's when we were meant to have babies. That's not the world anymore, right? But so can you ideally push hormones? I mean, I think thyroid gets undertreated a lot in women because of that. If you look at really young women's thyroid levels, they're on the very, very high end, higher than sometimes what doctors would, say, oh, we can't have a T3 that high. Well, if you look at young people, they actually do oftentimes have T3s that high. So I do think you have to sort of look at we're looking at age-related norms, and our age-related norms should be we'd rather have our hormones where they were in our 20s. So that's kind of my goal is to kind of keep the hormones at a healthy state that you were in your 20s potentially. And again, for some women, that probably was not super high. I think I'm probably not a super high estrogen person. Um, you know, but you see some of those women who look very estrogenic. They probably were always estrogenic. So, Meghalaya, my answer to that would be that yeah, I think that base it on not your chronologic age, but your goal age, which would be somewhere more in your 20s, and then keep, and then how you feel, right?
Does that
Um,
answer your question, Magdalena? Good.
and
Okay.
then
Yeah,
thought
there's
about
an
growth hormone to be added after 50. So here we use a lot more, and it's a little different where you guys are. In the European countries, is I think they're using more growth hormone. Growth hormone is difficult to get here. Access is difficult and expensive. But even beyond that, we use much more of the growth hormone secretagogues. So growth hormone releasing hormone and growth hormone releasing peptide. Our most common go-tos are CJC as a growth hormone releasing hormone and ipamorelin as a growth hormone releasing peptide. The two synergistically raise growth hormone, or IGF, the best. The problem with using straight growth hormone, even though it has a very strong influence and people like it, is it sort of keeps this very steady high state of growth hormone and subsequently IGF, or insulin-like growth factor, that the growth hormone is causing to be secreted. And that overfeed of constantly on the receptors can cause some receptor burnout, which you don't see with the growth hormone secretagogues because they surge the growth hormone. They use your own patterning, like taking them at night or taking them after workout to get these surges. So you don't get the receptor burnout that you'll see with growth hormone with people who take it a long period of time. And what happens is people who take it for a long period of time keep up the dose, and then you start seeing this very high levels of IGF, and that will cause organomegaly. If you think about the old bodybuilders, remember how they had those little turtle looking stomachs, really weird. The stomachs kind of protrude and you could see the muscle, but they're really weirdly protruding out. It's because they actually had big old huge spleens and livers because they've taken so much growth hormone that it caused growth of the organs. And you won't see that with the secretagogue. So I like the secretagogues better for that reason, beyond the fact that they're difficult to get here. I just think they're a safer way to go and you're going to get more physiologic dosing of them. And
hmm.
then your last question was, levels of testosterone are in the middle of suggested ones. I don't add it on. I'm thinking now listening to you, it'd be good to add a little. I guess it depends on your goals. I mean, I would say that if you're in the middle range and you feel good and your sex drive is great and you can have good orgasms and you feel like you can build muscle well, then you're probably fine if you're in the middle of the range. But if you feel like my libido could be a little bit better, and I feel like I'm just not quite putting on muscle the way I would like to. My energy levels aren't great, it might not be a bad idea to push it up a little bit. I would say, is it critical? I mean, I think that's great because, it is pretty rare to see, and it's probably because you are so fit and take such good care of yourself, but the but it's pretty rare to see. And I kinda look back to sort of how you looked a little bit when you were probably at your highest testosterone levels, which was like 16, 17. And if you were somebody who was a little bit kind of more on that, muscular build, then you probably, had higher testosterone levels, and that's probably more your physiologic baseline. I know you're kind of on that thinner side, so maybe that's a fine level for you. Um, I would say that experiment with it a little bit, try a little bit and see, wow, no, I actually do feel better, because sometimes we don't know what we don't know. And sometimes just experiment when you're like, no, I hated it. And then probably you're on the right level now.
Thank you. But should it be this the cream? The cream?
Yes.
Put-
Oh, testosterone and estrogen never take orally. Both of them dangerous orally. Testosterone actually has very liver toxic taken orally, so both should be transdermal creams. That's why you can play with little tiny doses of it. Honestly, like you can dose testosterone at a very small dose, and you're like, yeah, I just feel a little better.
Yeah, I would like to try,
Yeah,
because of the muscles. We
yeah.
are getting older and we see the
It's
difference
just harder, right?
little
You
by
go you go
little.
work out and you start losing strength. I
Yeah.
wanna go to the gym and still be able to lift the same weight as my 20-year-old daughter. So, that so I think that's probably a big place. And remember muscle mass, not getting sarcopenic, not losing muscle as we age. You're gonna find that more and more literature is supporting that the myokines muscle produce are so important to every other organ, including our brain. People who have more muscle have less dementia. So, it's really is I think, a very overlooked organ. It's a huge organ. It's a very overlooked organ. It's producing a hormone. It's producing these myokines that that people don't even, doctors don't even know, exist. I got a question from one of my podcasts saying, if these myokines are so important, are they teaching it in medical school? So I actually texted one of my friends who's in Rush Medical School, um, and he was one of my kids who worked with me for a while. And so I said, "Hey, Eric, are they teaching about myokines in medical school?" He goes, "Nah, I don't know what they are." So they're still not teaching this stuff, and yet it's critical. It's just an unfortunate truth about medicine is just not changing very rapidly. But you're going to find more and more as you read that myokines are going to be a big piece of health.
So testosterone cream might be better solution than adding, let me say, growth hormone with this Pfizer pen.
Yeah, I mean, I would probably with you because you don't look particularly growth hormone deficient. And I will measure. The best way to decide about growth hormone is to see what your IGF levels are, so you can measure IGF.
Yeah, I
If
have.
it's yeah, so if your IGF's decent, then I would probably say try a little testosterone. It's cheaper. It's easy
Easier
to
too.
use. It's a lot easier to
Here
do.
in
Right?
our
Exactly.
country,
It's a
it's not a
transdermal cream.
problem. It's not a
Yeah,
problem if you have a doctor, and it's also for me, I think it's quite cheap. 100
yeah,
euros for one pen. I
yeah.
think
So
it's a
yeah, it's a lot
pretty
cheaper
good
than here.
price, yeah.
Yeah. Yeah, and you may want to do both, a little bit of growth hormone, a little bit of, of transdermal testosterone, but I think you would benefit. I think there's very few women as, who are getting in their 50s and on that don't benefit and feel better on testosterone.
But may I ask you, what should be, how much of testosterone? What a percentage?
So, here we'd kind of dose it as a sort of a milligram or gram, and that dosing is so incredibly different, Magdalene. It's hard for me to sort of give you a dosing on that because I will have some women who I have on literally, 0.25 milligrams, and some women who I have on 10 times that dose. So it's
Oh,
kind of all across the board. And again, I'm not sure because the European dosing, I always get confused when I see this because it always when I have patients who have stuff from Europe for me, it's a hard time conversion because we're always doing a milligram per gram in a gel here, and things are always a little bit different there. So it's a little hard for me to comment on that.
yeah, I will go to doctor anyway, just to get your opinion, which is very
Yeah.
important to me. Thank you.